Good morning everyone. I am Dr. Rupali, currently working as senior resident in MKCG Medical College. So who doesn't want a long, thick, healthy hair? So hair not only an skin, important skin appendage, it also defines beauty and cosmetics. So nowadays in the era of beauty in 22nd century, where hair fall is a great concern among youth as well as for elderly people. So now in today's video we'll be discussing about what are the important causes of hair fall and what is the most important cause of hair fall that we are encountering in our daily OPD basis, and what are the treatment to be followed in those patients. And also in the end I'll be giving a simple hair care tips. Today's video will be discussing our topic of interest, that is the causes of hair loss. So broadly we'll divide the diffuse causes of diffuse hair loss, that is non-cicatricial type, where there will be no scarring, hair follicles will be intact. So the most common things that we are encountering, that we are seeing in our are androgenetic alopecia and the telogen effluvium, and also there is another entity that is called anagen effluvium, which is beyond the scope of this video, because anagen hair follicle that can effluvium that can be divided into two parts, that is because of intrinsic factor or extrinsic. So in intrinsic there is one entity that is loose anagen hair syndrome, another one is called extrinsic, that is because of anti-metabolites. Metabolites means that drugs that you are used in cancer, and also some anticoagulants like warfarin. Those things that lead to anagen effluvium, but these hairs after stoppage of chemotherapy, radiotherapy, those hairs gradually come back. So one thing we can do in these cases, we can give ice packs over head scalp that will prevent the endothermic reaction that occurs during chemotherapy or radiotherapy. That can be given half an hour before, and also it can be continued after 1 to 2 hours after the session. That can also help in preventing the more number of hair loss in case of chemotherapeutic and radiotherapy that is given in case of cancer. Now coming to the most important causes of hair fall that we see in our OPD patient, that is androgenetic alopecia and telogen effluvium. So first coming to the telogen effluvium. So when a patient is coming to you and says, doctor, I am having around 10 to 20 hair falls a day, let me tell you one thing, loss of 10 to 20 strands of hair in a day, that is quite normal. So when there is more number of hair fall, that is more than 100 to 150 strands of hair fall, that is only called as telogen effluvium. So there are various causes of this telogen effluvium. First one is if the patient is having any febrile episodes such as typhoid, fever, malaria, TB, HIV, and also the important one is our post-COVID era. Now patients are more that they are having some episodes of COVID last year. So it generally occurs 2 to 3 months after any insult to your body, and also some stressful conditions such as postpartum alopecia is there, and due to starvation, crash diet nowadays, these all lead to this type of telogen effluvium, and also other conditions such as any organ dysfunction like hepatic failure, then this renal failure, that also leads to any malignancy, that is leukemia or lymphoma. If the patient is having hypothyroidism or hypothyroidism, both of them can lead to telogen effluvium. And another important one is iron deficiency, and patients are more after hair color, hair straightener, and all these things that lead to damage to the hair follicle, and there may be telogen effluvium. So when a patient of telogen effluvium is coming to you, so in this case there are certain some bedside test you can perform, that is hair pull test. So what to do in this hair pull test? We need to tug around 20 to 60 hairs from the scalp. Don't do it forcefully, of course. So when there is more than 10% of hair fall, so that is called hair pull test positive, which is mainly seen in case of active hair fall. When there is hair fall is hair shedding is very active, so which is seen in case of telogen effluvium, of course, and also anagen effluvium and loose anagen hair syndrome. So and another thing we need to carry out, so there are some investigation that we need to carry out. That is, first we need to rule out whether the patient is having any iron deficiency anemia, so we need to send for hemoglobin, and also we can check the thyroid profile of the patient. As I have told you already that hypo or hypothyroidism both can lead to telogen effluvium in a patient. Let's discuss about the most relevant cause of alopecia, that is popularly known as androgenetic alopecia or male pattern baldness. So the most important cause in this case is autosomal dominant inheritance, but nowadays it is called polygenic inheritance. So if your father or your grandfather, they are having this kind of alopecia, then the son may land up in this kind of alopecia, that is androgenetic alopecia. So clinically this is very good, very easy to know that there will be bitemporal or frontal recession of hairline, and also there will be scarcity of hair over the vertex area, that is over the central part of scalp. So in this case we can diagnose it definitely as androgenetic alopecia. Other causes are like increase in serum androgen level, mostly the hair fall that occurs over the androgen sensitive hairs. So those areas most predominantly present over the frontal and bitemporal part, but the occipital area is definitely spared in this kind of alopecia. In female pattern of baldness, there is a diffuse thinning of the hair over the scalp, and also there is widening of the hairs on the both side of the central parting. And all these things we can this male and female pattern of baldness, that we can classify into different scales. So there are two scales available. For male pattern there is Norwood Hamilton scoring is available, and for female pattern Ludwig scale is available. And how we can diagnose this case? First we see the clinical diagnosis, that seeing the clinical criteria that I have discussed now, and also we can do trichoscope where we can see the miniaturized hair. What are the treatment modalities available in case of this kind of alopecia? So first one is the general measures. So in general measures I have kept diet, proper exercise, and also the adequate sleep, which is most important for a healthy looking hair. So in diet, what are the diets to be followed in case of alopecia? So the food, as we all know that hair is made up of keratin, which is protein. So the food which are rich in protein, calcium, vitamin D3, vitamin B12, biotin, zinc supplements, iron supplements, and omega-3 fatty acids. The food like pulses, lentils, and dal, the soybean which is rich in protein, and apricot, avocado, then food rich in irons, that is green leafy vegetables, spinach, and beans. All these things should be taken for your healthy growing hair. In telogen effluvium, we need to reassure the patient that they don't need treatment apart from food supplements. So we can give only multivitamins in form of biotin, omega-3 fatty acid, food that is tablets that is rich in zinc, iron, and all these multivitamins we can give to the patient. And in this case we need to reassure the patient that the hair they regrows back within 6 to 9 months. But in case of androgenetic alopecia, the main treatment that is given, that is the gold standard of treatment, that is minoxidil. So this minoxidil solution available in form of lotion. So it is available in percentage like 2 to 10%. So in case of female pattern baldness we can give 2%, but in case of male we can give like 5 to 10%. So this can be given for 1 ml twice daily. We have to give for 6 months. So 1 ml we can give, or it is also available in form of spray. So 1 ml 5 spray is equivalent to 1 ml. So accordingly we can use. So this prescription will cost you around there will be 700 per month. And also we can give some oral medications like finasteride and dutasteride. So finasteride is available as 1 milligram per day we need to give, that can be given for 6 to 12 months. And dutasteride, which is more potent but it is costlier than finasteride, which is to be given in a dose of 0.5 milligram per day. So the finasteride will cost you like 300 per month, and this dutasteride will cost you like 900 per month. So all these drugs can be given, but we need to reassure the patient that he needs to apply for a long term. Like we need to counsel the patient. There is no permanent cure. Hair fall decrease by 6 to 9 months of application of this minoxidil, and hair regrows back around 1 year. So all these things should be counseled to the patient while we are prescribing minoxidil or finasteride. Coming to the interesting treatment modalities, that is the intervention part. So in camouflage, we can use hair extension, hair wigs, even keratin fibers, and also hair sprayer. We can advise the patient. And in other treatment modalities, like we can give PRP to the patients in as a maintenance therapy. So those patients who are on hair transplant, they can be maintained with platelet rich plasma. So in these cases that we are also carrying out in our hospital setup, we are giving platelet rich plasma, where the platelet rich plasma is extracted from the patient's blood itself, and after centrifugation and after getting plasma, these are all we are injecting along the growth of hair strand, and we need to repeat each cycle in every month. So this actually this is a newer modality, and all these treatment responsiveness varies from patient to patient. So all this treatment that will cost around 3,000 to 4,000 per session. That varies from dermatologist to dermatologist. Other treatment modalities are like derma roller we can do, and also we can do laser therapy. So the mechanism behind all these therapies are we are just stimulating the hair growth factors like hepatocyte growth factors, vascular endothelial growth factors, fibroblast growth factors, and all these growth factors. And also there is also stimulation of hair follicle blood vessels, that is vasodilatation occurring around the hair follicle, and that all leads to hair growth. And next our last resort is hair transplant. So there are few experts that those are available in Odisha. So it will cost you around 1 to 2 lakhs, and we need to maintain this therapy with topical minoxidil application. That will cost you around, of course, 700 to 800 per month. This is the last resort in case of all these androgenetic alopecia. So that can be also another good. So last part of video, I'll give you the simple ideas about the hair care tips. So we need to shampoo our hair not too very often. So we need to shampoo our hair like twice a week for oily scalp, followed by conditioner. This actually softens your hair, and it should be applied not over the scalp, rather over the cuticles, followed by a good shampoo. And those who are having any hair infections such as tinea capitis or seborrheic capitis, that should be treated using ketoconazole shampoo. But remember, this ketoconazole shampoo sometimes dries your hair. Don't over treat your hair, and we need to use cold or lukewarm water. Always avoid any hot water application over your hair, because that will damage cuticle of your hair, which is the protecting covering of your hair. And also we need to avoid excessive treatment, heat treatment. That is, nowadays most of the people, they're over treating their hair with blow dry and also hair straightener. All these things should be avoided. Once in a while it is okay, but we need to avoid repeated use of this blow dry and also hair straightening. And also now I'll tell you that oiling is not that much mandatory, because our hair is having sebaceous gland that secretes oil, and even you are applying oil or massaging oil, that definitely leads to good supply, good blood supply to your hair. But we need to do it around 30 minutes to 1 hour before your hair, then we can shampoo hair. In today's video, we have covered the important causes of hair fall, and also we discussed about the treatment modalities, the diet that should be taken, and also in the last part of video I told you some hair care tips that can be practiced in our daily to daily habit. And I think this video will be very useful to you, and see you in my next video. Till then, keep watching the video. Hare Krishna, Hari Bol.